Hi, I'm Dawn Marie Solis with Neuro Awesome Life and Neuro Awesome Life Conversations, and I am here with a returning guest, Brian King. He is a wonderful neurodivergent human who helps folks understand relationships with neurodivergent people. Today, however, we are going to be talking about something that is a passionate advocacy space of mine, which is access to medical care and therapeutic care. Brian and I both have our own experiences with how challenging that can be. And I reached out to Brian and I said, hey, do you want to talk to me about this? And gratefully he said yes. So Brian, thank you. I really appreciate you being willing to talk with me about your experience and your thoughts on this really important topic.
Well, not just interested, enthusiastic, because I've got, in addition to all my neurodivergent challenges, I have multiple sclerosis and Ehlers-Danlos syndrome. And for the past, since 2011, when the symptoms started, I have been going from one doctor to the next, trying to get my pain managed. And it's only gotten worse over the years. And recently, I had reached crisis level where the pain was so bad and couldn't be managed that I broke down in the office of my neurologist, just sobbing, telling him how I was losing hope. Nobody was giving me any answers. And I explained to him that one of the problems I was having was nobody seemed to be interested in learning about Ehlers-Danlos syndrome and the implications that it had. And I've been telling this guy, who I've known for 5 years, he's the one that diagnosed the MS. I've been telling him for years to stop looking at MS for the cause of my nerve pain. But he kept thinking, my specialization, I have to answer it within that. And I think it was last week when I had this coming to Jesus moment, where I said, I wish they just listened to me and learn about EDS and how it could be causing this pain. And he said, well, that's funny you should mention EDS, because I just went to a seminar 2 weeks ago as part of continuing education and sat through a presentation on a corrective surgery for hypermobile sacral iliac joints. And that's what I've been telling my doctors all along was probably the problem, that they needed to test me for that. Well, they just pleaded ignorance. Well, I don't know about that. It's not my specialty. So they blew it off and let me suffer instead. So the irony of this, that he had just learned not only that hypermobile SI joints was a thing, but there was actually a surgery to correct it. And that completely changed the tone of the conversation, because I was no longer crazy, because he now had a precedent for what I was saying. And he wrote me referrals to EDS specialists he knew of. I mean, it's almost like because he didn't know about it, it wasn't something he needed to take seriously. And this seemed to happen with all my doctors. And if anything, this shows where there are glaring chasms in the knowledge base of the doctors practicing today. Because the people with EDS, it's like almost like the autism numbers, where it just keeps growing in number, and yet efforts to catch people up on this seem to be non-existent. It has to be the motivation of the doctor to want to reach out to a specialist and say, hey, I met with this patient today who told me this. Are you familiar with this? But they don't even go that far. And I have suffered unreasonably for the past 5 to 8 years because of willful ignorance on the doctor's parts. So that's my 2 cents at the moment.
I'm so sorry you had to go through all of that. I am reservedly encouraged that somebody is taking you seriously, at least. I hope that does lead to some kind of help. And I relate to everything you just said. I have only found 2 medical professionals in my area that have even ever heard of Ehlers-Danlos. And the only thing that they know to say is there's nothing that can be done. We might be able to manage your pain a little bit, but there's no treatment. And one of the things that's an exceptional struggle, like you said, is that in general, if you bring a condition to a physician that they have not heard of, they doubt its reality and your truthfulness. And that's something that I have been through over and over and over and over again. Literally this week, yesterday. Nope, 2 days ago. 2 days ago, my joint pain was so bad, I couldn't navigate my stairs. I only have 6 stairs. I have one of those, sort of half level split ranch things, only 6 stairs, and I couldn't do it. I was in excruciating pain. So I took myself to a walk-in clinic. I did that because for more than 6 years, I have been saying, please help me with my joint pain. Please help me with my joint pain. And I have gotten answers like, well, we can't look at you holistically. We can only do one thing at a time. And for whatever reason, they are fixated on my lower back. Every time I get any kind of referral, they put it through as my lower back. And I get that call, hey, we're here to make your appointment for your lower back. I'm like, okay, yeah, that hurts, but it's not what I'm talking to people about. Like, why? Well, I'm sorry, we can only look at what your referral is. So there's like some kind of strange, almost like manipulation of my experience where people won't listen to what I'm saying and give me the referral I ask for. Going to the walk-in clinic is the first time in more than 6 years that I've gotten anyone to take me seriously. And I now have an orthopedist referral. This orthopedist has at least heard of hypermobility.
What do you think made the difference that time that you were heard?
I went to the walk-in clinic complaining of ankle and excruciating ankle and knee pain. So, I didn't go to the emergency room for it. I didn't think anything was broken, but I did go to a walk-in. I've been through several primary care doctors because of them putting impediments to my care in the way. One of the doctors, my husband sat in on this particular doctor's appointment because it's hard to believe, right? You go to the doctor, it's really hard to believe. You come home, you tell the story of, I told them about joint pain. They told me to see a psychiatrist because that's one of the most common things that I get. Well, go see a psychiatrist. But I'm talking to you about my joints. I know. This doctor, my husband sat in on that meeting. She admitted hearing how bad my knees were, feeling how bad my knees were, asked for 2 weeks to come up with a plan, and wouldn't refer me to anyone but a psychiatrist.
Talk about this. This is a demonstration of the medical misogyny that happens. Because I have a master's in social work, and one of the things that got picked up and also mentioned is how there were diagnoses created for the over-emotional woman.
Mm-hmm.
Because they were hysterical, from hystero, meaning uterus, right? It just this idea that if a woman has a complaint or a concern, it's going to be overblown because women are so emotional. And just think about how many cases of endometriosis go undiagnosed for 20 years because of idiot doctors who are projecting stereotyping or whatever to their female patients. It's disgusting.
I have been asking, so it's interesting you bring that up. I have been asking for somebody to look into that for quite a while. I finally, a couple of years ago, got somebody to agree to take my uterus out. I'm over 50, right? I'm now in my mid 50s. It took until after the age of 50 for anybody to be willing to do it, even though I literally bled every month close to needing transfusion level. I was so anemic. Like, it was horrifying. I joke because I have a really like dark sense of humor. I joked
that kind of evolves over time, doesn't it?
It does.
Yeah.
It does. The things I laugh at are not appropriate. That's the title of my book. But I grew polyps like dandelions or mushrooms. Like, it was dozens of them all the time, which is why I bled so badly. And I'm like, please, I'm done having children. Can you please just take it out? Take it out. And by the way, I think I have endometriosis. No one has told me I have it. But recently, as I was digging through my medical records for a different reason, I decided to look at more in detail the notes on my hysterectomy. Endometriosis is in there. Nobody mentioned it.
I wonder why that is.
I wonder why that is.
Because they might have to admit they were wrong about something. We can't have that.
Right. And this is the thing, right? I am autistic. I can get really intense, really intense. It doesn't mean I'm upset. I can be happy and intense. I can be not particularly emotional and intense. It depends on what I'm doing to mask at the moment, right? But if I go into any kind of medical situation, I have to mask so hard, exhaustingly hard, because if I appear any version of anything but complete sweetness and calm, I'll get treated as though I'm being super rude, not worth their time. I've been blown off like you wouldn't believe. I was having a heart event, went into the cardiologist, 190 over 113 blood pressure, and the cardiologist said, "You just don't like doctors' offices. All you have to do is calm down and leave the room." And he left the room. And that's not what was happening. It took until a different appointment where I had a scan of my heart, and I have what they call a regurgitating valve, right? I was having an event, but he saw a hysterical woman, right, who must be afraid of doctors, and told me to just calm down.
These cases cannot be documented enough.
Right, which is why I'm talking to you.
Yeah, and I wish there was, and I'm sure there is, but they don't make it publicly known. I wish there was some place to submit all of these, because a little education in diversity, the patriarchy, how we're conditioned to see things this way, some education in that, and replacing that with compassion, with listening, with believing your patient. Imagine how many of us would be served earlier and better if the doctors just got over the God complex into thinking they have immaculate perception and the patient couldn't possibly add anything to the conversation.
Yes. And this is something that's actually a really dynamic, maybe is a good word, dynamic conversation or argument in the medical field right now is lived experience an appropriate addition to a scientific field? Whether it's research or being able to report our own situations, the medical world right now is discussing whether or not lived experience is a valid addition to either research or diagnosis.
Let me tell you what that does to me, you saying that right now. Because part of the problems that I've had all these years is if it doesn't show up on the scan, it isn't happening. And
yes.
A lot of EDS, it isn't glaringly obvious on a scan that you've got stretchy ligaments and tendons, that they're inflamed. And that's the problem I've been having with my pain doc for the past year. well, we took an x-ray, we took an MRI, nothing shows. And I say, well, then that's the wrong test, because I'm still in excruciating pain and we're still not doing anything about it.
Right.
So I know what my answer to that question would be.
Yeah, could you please listen to us? Like, we're not attention seeking or hypochondriacs or just lying for whatever reason.
We want to feel better.
Right. And, I was thinking about this before I opened the computer and stuff like that, knowing that I was going to talk to you. And I'm like, what's happening right now? Brian and I are coming and we're going to invest a lot of energy in this conversation, while at the exact same time, we're both in a lot of pain. If you and I right now listed the number of places in our body we were in enough pain that some part of our brain is focusing on it, right? I'm sitting here rubbing my knees. I'm sitting here trying to stave off the migraine that I can feel coming, right? My neck and shoulders always hurt.
Well, you wouldn't know it, but I am working from my bed. The head and the knees elevate, because I was planning on working downstairs, my office. But as I bent over to pick something up in the bathroom, there was a nice pop from my low back. And that pretty much told me my legs are not going to do up and down the stairs multiple times. I just need to settle in.
Right.
And my clients, I mention it to my clients because I want to be transparent and say, I work in whatever way I need to be able to produce, meet my goals, regardless of the fact that my body seems to be destroying itself. And if you want to have a fulfilling life by any means, you've got to learn to live with the unacceptable.
Yeah. That is a sentence I wish I didn't have the passionate need to repeat, end quote. Right? If you want to have a fulfilling life, you need to be willing to live with the unacceptable.
I read an article from somebody, I think she had EDS, but was walking around with that intensive pain like we tend to have, 8 or 9. But our nervous system protects us. We can kind of numb ourselves. We can dissociate. And she was being told by the doctors, there's no way your pain is that high. You'd be screaming. You'd be rolling on the floor. So here's what her takeaway was. She needed to lie and tell them a number that they believed before they would treat her.
Right.
To me, that makes me want to, I'd say, pull my hair out, but that boat has sailed, right?
So, your eyebrows. You can pull your eyebrows out.
Oh, I do that anyway, but that's a different story.
Yes, I understand that. Mm-hmm.
The whole anxiety thing.
Yep.
But just the fact that an honest reporting of your experience doesn't get you care. You have to tell the doc what they want to hear.
Right.
Or they'll send you off like you're a crazy person. It's
right. And my autism is very devoted to exactness and honesty. And answering the pain question is a really difficult thing with that mindset. Because they generally ask you, what is your pain level right now? Right? That actually wasn't what they needed to ask me when I was in the walk-in clinic. What was your pain level when you tried to walk up the stairs? That's what they needed to ask me. Not what's your pain level while you're sitting here doing nothing, right? Sitting there doing nothing, it was about a 6. But going up the stairs, I collapsed and cried. And I'm not that's not how I respond to pain generally. I actually have, like you said, like a really high pain tolerance, which is part of what they ask me, like 0 to 10, 10 being the worst pain you've ever felt. And my answer is almost always, I had a multiple fracture in my arm and hand, and I've given birth 3 times. Compared to those 2 things, okay, maybe we're at a 7, but that's not valid. Those are like
Another
Over the
thing,
top.
another thing they're missing, and I often change up that question when they say, how's your pain right now? I said, you mean after I've had to generate all this adrenaline just to get here, and I'm fatigued now and I can't focus? But what you pointed out going up and down the stairs, how is my pain during my activities of daily living?
Right.
Because asking me how I feel right here, right now, well, I don't live in your office, Doc.
Right.
Talk to me about when I'm driving to work or when friends want to invite me out. I'm in the middle of a restaurant. Ask me about that.
Right.
Ask me what I can't do because doctors keep blowing me off instead of helping me manage this.
Right. And this is happening to thousands upon thousands of people. For folks who are in social media groups for autistic people, one of the most common things in there is, does anybody have this pain? Does anybody have this digestive problem? Does anybody have headaches all the time? There's a lot of conversation around our health concerns and needs. And most of that at some point turns to, and I can't get care. Come June or July, I'm going to be doing a panel discussion for this YouTube channel with some folks from Autistic Doctors International and a couple of other, got a chiropractor from the United States West Coast. We've got a wonderful neurodivergent woman with her doctorate in, I can't remember the specific term, but it's like analyzing the numbers, right? She's really good at understanding the numbers around things. And we're going to be talking about access to care. And you mentioned, I wish there was a place we could like register our experiences. Organizations like Autistic Doctors International, who they do research, they're autistic led, produced and analyzed research projects, all having to do with autism.
Fascinating.
Yeah, they're based out of Great Britain, but they are a multiple country, 700 plus member organization. And you can find them on Twitter, Facebook, your social media platforms. Tweet at them, Facebook message them. They want to know, because part of what they're doing is gathering information, gathering experiences, and they're very, very promotive of lived experience as valid.
Amen to that.
Right?
I mean,
Yeah.
On a side note, I've got a client who has learned insight into her various traumatic challenges and OCD, and she has such a refined insight into her own experience, and her emotional intelligence is so incredible. I would put her up against any trained therapist any day. But she learned it by being in the mud.
Right.
Not just sitting in a classroom or in a library reading it all up. She can speak from her bones about what it's like to live with this stuff and do the hard work of healing. And I think that her lived experience should be considered a credential.
I agree. I absolutely agree. Is it true that some of us autistic folks don't have that ability to synthesize information and pull out accuracies? Absolutely, because autistic folks are the same kind of range of humanity as anybody else, right?
Well, just like, every physicist is not going to be Stephen Hawking.
Exactly, right? However, one of the things that is somewhat common amongst autistic people is that we do have fairly developed interoception. We actually can feel what's going on in our bodies in a very connected way that evidently isn't quite so common in folks who aren't autistic. So when somebody asks me, can you, what do you feel? I will tell them I feel things. And they're like, you can't feel that. There are no nerves there. Like, I don't know what to tell you, because I do feel it. I'm not lying.
My first surgery back when I was 17, before they knew about the EDS, I had to do surgery on both of my knees because my kneecaps kept catching on my femur. And my leg would hang up when I was sitting down or trying to walk. And the doctor was baffled about how I could have such knee pain, describing where it was because there were no nerves there. And I said, well, I don't know what to tell you. Mine hurt.
Right. But I'm not a researcher. I don't have patience for it. I don't have patience for it. I am so grateful for the people who can spend years looking at a thing from all different angles. But I really hope we start having results for current research that talk about how that happens. They hook up our brains and they watch our brains light up when certain things happen, because we are experiencing a thing. And it would be great if we could understand at least the car dashboard perspective. And what I mean by that is often when you're watching the brain, you're watching a signal that something has happened more than it's currently happening. You're not necessarily seeing causality in the brain. You're seeing response in the brain when the little synapses light up, right? Mm-hmm. So to me, that's like a car dashboard. The car dashboard tells you how much gas is in your tank or how fast you're going, but it doesn't tell you that there's a hole in your gas tank or that your engine needs repair, right?
Something else that just occurred to me is doctors are trained to do acute care. So when us chronic folks come in, they're looking for a red flag right here, right now. And that red flag for us is usually a cumulative kind of phenomenon, as opposed to we're looking for a fever or we're looking for high blood pressure. You might not get that with us, but what you do is have a historical pattern of these symptoms, and maybe that historical pattern means something. But so many doctors don't want to look for something chronic. They want something they can throw a pill at today.
Right. Right.
A lot of re-education in order here.
Absolutely. One of the things that I discovered last year, because I went on the hunt for it, I wanted to know what college or university, what medical school in the United States was at least trying to teach about autism and co-occurring conditions and things like that. I found none. There were a couple of medical schools that did bring up neurodivergence and talked about autism and ADHD to a certain extent. I'm currently unaware, it doesn't mean it doesn't exist, I'm currently unaware of any medical school in the United States that devotes a class to it. There may be class time, but there is no class. And considering folks who are autistic and do any kind, like if your autism is your special interest, we are loaded with co-occurring conditions, right? The digestive, the mobility, the, I don't know, there's a list. I don't have to list them all, right? We know that there's stuff about us that is different. Our brain talks to our body differently than other people's brains talk to their bodies. We should be figuring that out, and doctors should know that, but they don't. I had an opportunity to speak to a group of third-year medical students, and that means they've been through their undergraduate work and 3 years of med school focus, and they're just about to start their practical experience. They're going to get assigned to doctors' offices and things like that. And I was asked to come in to share about neurodivergence. So I did. They'd never done anything like this at this particular medical school before. So I didn't really have any guidance from them. Somebody had heard me speak. They talked to the assistant dean. The assistant dean said, that sounds interesting. And I showed up, right? So neither the students nor I really had a good understanding of what any of us were doing there. My point is almost always to help folks understand the human being. You and I share that desire to have relationship right out in front of our work, right? We
Right.
really want to help people learn how to be in relationship with one another. And so I told some of my story, part of which is being in an emergency room, that the nurse wheeling me into the CT scan room introduced me. This is Dawn Marie. She's autistic. That means she's potentially aggressive and violent.
What?
I had just been hit by a car. That's why I was in the emergency room. No one in that emergency room experienced, with the exception of one nurse who was a fourth-year med student and also neurodivergent, but didn't want anybody to know. Like, she kind of whispered that to my husband and me because she saw what was going on with my care. And she said, how about I just be your nurse until you leave? Which I was so grateful for. But so I shared some of my experiences and how access to care is a significant problem. But my overarching point was, whether you recognize the neurodivergent person, they self-identify or not, every individual you see is not a list of problems. They're a human being, and you need to hear them and believe them.
Something else to add to that. They're not just a list of problems, but they do have a list of needs.
Yeah.
And trying to tune in to what will help solve the problem is just compassionate inquiry.
Yeah.
You know, where does it hurt? What can I do for you? You know,
part of the reason why I tell the story of me going to this class and these students, about 30 emerging medical professionals, is because the school gave them a survey. How did you like the experience? And for the students that answered, there weren't a ton, but for the students that answered, I think there were 2 that were really glad I was there and felt it was valuable. The rest that responded said, Dawn Marie seems very nice and we're sad she had a hard time, but we learned nothing of value.
wow.
That was devastating. That was devastating. I don't care if they like me or my story or whatever, but that they could feel that they could hear everything I told them about what can, sensory challenges, overwhelm, situational, nonverbal, all of those things. No valuable information.
I'm curious just what their opinion is about whether they're ever going to encounter someone like us. You know, the neurologist, where I broke down in front of him, one of his first suggestions was that I needed to see a psychologist because I was hopeless and all that, and I kind of let him have it. I said, if a diabetic was sick, you'd give him insulin, not a referral to a psychiatrist.
Right.
I said, my problem is not my attitude, it's the pain.
Right.
If we get the pain handled, I'll be fine. And my pain has been better managed in the past week or so than it has been in the past 8 years.
Yeah.
But I had to fall apart in front of the man to be heard. And that's, like I said earlier, about having to live with the unacceptable. Why does it have to get to that point? Why do they not see, from you talking about your life journey, why did they not see sensory sensitivities, emotional dysregulation? Why don't they see that as relevant to how they engage their patient? It's a failure of the system that the thought that you are wasting their time is ever a consideration.
Part of my guess as to why that is one, psychiatry, psychology, and allopathic medicine are separate categories in our medical mindset in the United States. We're only just now in 2023 starting to realize that anxiety causes legitimate physical problems. It's not all in your head, right? That all in your head thing is this idea that somehow the brain has nothing to do with how we feel. right? Nothing to do with pain, nothing to do with the function of our organs. That the brain is somehow just a thing that makes sure your heart beats and you breathe in and out and you blink on occasion. And other than that, it has nothing to do with your physical being. We are learning that that's actually spectacularly untrue.
It goes back to the, if we can't see it, it's not happening.
Right. And we don't understand the brain. It's 2023 and we don't understand the brain. But also we have a society that rejects the value of emotion. That emotion is not valid in communication or consideration or diagnosis, right?
Sounds like this is a preoccupation with superficiality. It needs to look,
agree with
it needs to look right. You need to say the right words. You need to behave correctly for whatever your status is or whatever your faith or politics. As long as you act like you're supposed to, you'll be okay. But if you vary from that, there's something wrong with you. Hence the birth of the DSM.
Yeah, and for folks who don't know what the DSM is, that's the manual that is put out for psychiatry diagnoses. So right now we're at the DSM-5, 5A or B or something like that. We've got iterations of the 5.
Right.
And that's where you're going to find the definition of like autism symptoms or bipolar symptoms.
Here's the irony. There are no tests for autism, ADHD.
Right.
It's all observed behavior and how the patient self-reports.
Right.
So why do you listen to them about their feelings and their thoughts in that setting, but in every others, they can't possibly have anything to do with the problem?
We still have the self-reporting resistance in that observation testing environment. So if you get a tester who responds poorly to who you are, they will either be overly inclined to give you a diagnosis or under inclined to give you a diagnosis. When, at least right now, this particular moment in time, when the internet is exploding with information about lived experience as an autistic, ADHD, dyslexic, Tourette's, right? All of those identities exploding with information. We actually can figure ourselves out. We can ask lots of questions. We can figure ourselves out. And we can decide for ourselves if we relate to what other autistic people say is their experience of autism. Like, oh yeah, I relate to like 80% of that, right? If you got an 80% similarity in cancer, that'd be amazing. Like 80% in anything medical. This one looks like this one. That's spectacular. But we can't bring that to our care providers and say, oh, I have, at least 80% of the things all of the other autistic people out there saying they have. Can we please call me autistic? It just doesn't happen.
Yeah, and they tend to make, based on the comment that you experienced earlier, she's autistic, therefore she's inclined to be violent or whatever. If you have those biases, these stereotypes, the stigma, whether you're conscious of it or not, you are doing a tremendous disservice to your patients because you're not seeing them according to who they are. You're seeing them through a corrupted lens.
Yeah, we don't yet have in our culture here in the United States, in my opinion, a sense of differences in people or disabilities in people being acceptable and as though they belong. in this last year or so, I've gotten really intense about changing diversity, equity, and inclusion to diversity, equity, and belonging.
Yeah, that's very different.
Because for me, inclusion does a couple of things that I find repugnant. One, if I include you, Brian, it always has a time date stamp on it. There was a point before I included you, and there will be a point after I include you. I used this example. I get hired to do trainings in corporate settings, and I was talking to one of these folks who've hired me. And I said, in order to come in here today, I had to go through security and I had to get this badge. And when I'm done with this meeting with you, I will have to give back the badge and leave the building. The only time I am included is for the time I have the badge for this conversation. At all other times, I am not included. That means I don't belong in your building.
That's a great example.
So diversity, equity, and inclusion, right from the very beginning, says you can be different in the space that we own and you do not, as long as we say you can be here. But if we don't like who you are, go away, right? You don't belong. You're being tolerated. That's not a world that I want for neurodivergent people, for disabled people, for anybody.
It's wonderful that you teased it out that way, because inclusion in many scenarios is just becoming another box to check.
Right.
Okay, we asked them to join us. They didn't want to, so we did our best. Right. All right. But belonging means that you feel as though you are safe, you are wanted, and inclusion doesn't necessarily do that.
No, and for us neurodivergent folks who might have some of that social awkwardness, we're not totally sure what to do in a group, right? We didn't know how to play with the other kids, all of that, right? Somebody may let you sit at the cafeteria table, but it doesn't mean you're ever going to feel like you belong there, right? You take any Hollywood scenario of the unwanted kid getting called over to the popular table, right? Because one person there takes pity on the poor unwanted kid, right? That kid is not happy at the popular kids table. They're not. They're horribly uncomfortable. They're pretty sure it's going to go wrong at some point. That's inclusion. Great. They were included. And it was a terrifying experience. No, thank you. Goodbye.
And I remember, looking back at my school days, trying to add something to the conversation and watch people's eyes roll, or they change the position of their body, so now their back is to me. And there's all of this rejection, and yeah, they can pat themselves on the back for the day because they were big-hearted enough to include the poor little disabled kid. But once we're there, they think their job is done.
Right.
We let you sit with us. What more do you want?
Right.
To feel like I matter? Is that asking too much?
A recent conversation I had, again, in a corporate setting, I was helping a manager try to understand how to create a sense of belonging for a neurodivergent employee. A 10 by 10 office was about to be the office for 6 people. They weren't all going to have to be there at the same time, but it did mean the 2 desks that were in there were going to be shared by 6 people, which means you can't leave anything there, right? You can't have a space at work that's yours. And this was very, very difficult for this particular neurodivergent employee, because part of being able to be at work is being able to understand their environment, have consistency in that environment, and have some items around them that help them feel grounded and safe. In a shared situation, that's not possible. And this particular manager was very put out that they were going to have to figure out what to do for this neurodivergent individual. And part of the issue is that it is possible the other 5 employees didn't like it either.
They're just too afraid to speak up.
They're not speaking up, especially when they start to see the one person who's known to be neurodivergent receiving some pushback and people feeling frustrated about them, right? Why on earth would I speak up to say, hey, I kind of feel that way too. I don't think this is appropriate that we all get shoved into a 10 by 10 space and we've got people sitting on the floor in the hallway to do their work because there's not enough room for us all in there.
One of the most toxic aspects of our culture is how based it is on your ability to produce for the economy.
Yeah.
And I think that's one of the reasons why retirees continue to get screwed by lawmakers, kids, education stuff, because if you don't have a job and are paying your taxes, you have no value to us.
Right.
And there are corporate mindsets like that too. You need to come in, be a drone, don't have any emotional needs. You are here to be healthy, stable, and crank out as many widgets as you can. I don't care about your home life. I can replace you tomorrow if you don't like it. And there are so many bosses like this. I wonder if they ever step back and listen to themselves, because it's such an abusive attitude.
But it is how we're educated. We're educated from 4 or 5 years old to believe if you can't get the right answer, we don't want you. If you can't sit still for 6 hours a day, we don't want you. I was talking to somebody earlier today who was mentioning riddles in the classroom, that children sometimes get like a warm-up riddle, right? You have to answer, you have to figure out the riddle. This is a neurodivergent person, and they would figure out an answer that wasn't the expected, but actually made sense. They could prove the logic, and that they only ever found one teacher that would accept their logic as valid and get the point or whatever for the exercise. All the other teachers that utilized this warm-up method would say, no, that's not the right answer, and would get mad if this individual said, well, but isn't it logical? Like, given what all of this says, isn't this a version of an answer that could come? That was just like, you're being difficult, go away, right? No ability to think differently. So yeah, we can get really frustrated with business owners and managers, but they're literally taught this is how good business gets done. You need to extract as much as you can from the meat sack that shows up at work every day. And if they bother you, you're in a position of power. You don't have to be bothered. And there are voices out there right now that are really critical of companies who are trying to change that. We're trying to create community. We're trying to create spaces of belonging, no matter what the human beings are that walk through the door.
I wonder, and I'm sure you know this, what is the resistance to that change?
It's my personal belief. I've done emotional intelligence coaching for almost 30 years now. The people who are interested in knowing what emotional intelligence is and how I coach are folks that are not afraid of their own emotions. That's not your average person. We get taught that our emotions are inappropriate.
Oh yeah, that was the message I grew up with.
Right.
You're overreacting. You have to get yourself together. Why are you so sensitive?
Right. And there are different styles of messages depending if somebody's born sexed male or born sexed female. in whether or not, but you mentioned it right in the very beginning, right? Talking about medical misogyny, where we're not even 70 years away from the most common diagnosis for a female is hysteria, right? That used to be the most common diagnosis for a sexed female human, hysteria. No matter what was wrong, women were dying all over the place. They were just hysterical, right? They were too emotional and it killed them.
Get me started on what the treatment for that condition was.
Oh, that's a whole other conversation. We can do a medical history. That's a special interest of mine. We can do a female medical history conversation. Yeah, we still don't do equivalent amounts of biology research with female anything. So it doesn't matter if it's a human being or another species of living creature on the planet. Our model tends to be research the male of the species, and that'll probably cover most of it. So who cares about the female?
That's why diagnosing a female with either autism or ADHD was almost non-existent, because if you didn't look like the guys did, you don't have it.
Right.
And what we're learning now is that the brains are structurally different. You know, the emotional aptitudes are different, and the way that influences the way it presents is very different. And knowing that allows you to realize the ratio is more like 50-50 than it is 4-1.
One of the things I'm really interested in, and I hope some research team out there is doing it right now, we are not a species with a sex binary. It's not just males and females. There are intersex folks all over the place, and a lot of folks aren't discovered unless they have a medical condition that requires looking inside their body and discovering, oh my goodness, you have more reproductive parts than we thought you did, right? Because what they show on the outside appears one sex. They actually have the other sex organs as well. I'm really, really curious about how the fact that we are a multi-sex species plays into brain development, emotional aptitude, all of those kinds of things. Because in this binary perspective, we've created this idea that there is a way to be masculine and a way to be feminine. And it's only fairly recent in our human history that we're allowing some crossover, right? But the fact of the matter is there are actually lots of people that are biologically crossed over. There are more than one.
This is news to me, that you can have the internal,
yes,
but the external looks like one. That's fascinating.
So there are cases of people who would be identified as male at birth, having blood in their urine like all the time. And when they finally get somebody to take them seriously, they find they actually have a uterus that is having a period every month, and the blood is coming out through the urine.
That is wild.
Right. There are people who are born with the obvious female parts, but have extremely high levels of testosterone. They'll grow facial hair. They'll tend to have lower voices. They'll tend to not have a period consistently or sometimes at all. And there are other physical challenges that can come with extra testosterone. And it can go the other way as well, but we don't talk about that much, right? We don't talk about the men who grow breasts. We don't talk about the men who their voices tend to stay high, right? Well, there's a lot of estrogen in that bodily male human being. We don't talk about the existence of many, many, many people who are in some way not just one or the other. We don't have a binary in the human species. There's actually not a binary in any living creature.
Yeah, I was going to
All
say
living
that.
creatures have some intersexed versions.
Well, and there are, throughout the animal kingdom, even in insects, you see same-sex relationships.
Mm-hmm.
So anybody who says, well, it's choice and nowhere else does this exist, well, now you're choosing to lie to yourself in order to bolster your argument.
Or ignorance, right? You
Yeah.
didn't know the things I just said, right? And I hope anybody else who's watching this quickly goes and Googles and, don't always do your fact checking, right?
That's why it is so important that we enter into conversations with each other from that point of, I want to learn what I can from this person, instead of, I'm going to show them how right I am, and I'm going to beat them into submission until they admit that I'm right.
Oh my goodness, yes. That's a conversation that I'm trying to have with a lot of folks.
Well, let's keep having it.
Yeah. How do we learn civil discourse when our education systems teach rightness? You might be able to learn debate in school, but debate isn't civil discourse. Right?
Not to mention their values are so dichotomous. It's the right answer or it's the wrong answer. You were on time to class or you were late. And there's no appreciation for all of the gems that live in the gray area.
Yeah. Now I want to have that conversation with you. We should talk a lot. We should talk a lot, and we should just hit the record button and put it out there, and maybe people will find it interesting.
I'm not only game for that, it's something that I'm looking for opportunities to do, because podcasts are fine, but they're too linear. And it doesn't allow for that kind of spontaneous, free flow, organic kind of way of being that leads to those creative connections. Like,
Yeah.
I never thought of it that way, or I never thought of it this way. Well, it's because typically in a very short-sighted academic environment, there's no room for it.
It's why I do my channel the way I do it. Basically, I decided some number of years ago that I didn't know how to be the person people were telling me I was supposed to be.
Mm-hmm.
And trying to be whatever that was hurting me in spectacular ways, physically, mentally, emotionally. And so I decided I was going to identify what can I do and do that, and cross my fingers that I'll find people that enjoy that, find it valuable, right? And I've discovered the more I'm willing to truly be myself out there in the world, there are folks who do appreciate who I am. There are lots who don't. And that's fine. We're allowed to be different from one another.
We don't like a lot of people around us anyway.
I tend to like everybody, but I'm autistic, right? I'm that kind of autistic person. I'm like,
yeah. I by default want people to be good.
Yeah.
And it's easy to trust all the wrong people far too often with that.
Yeah. Yeah.
And when you do find the people that are good, keep them close. Because that's what makes the difference when the majority of the world isn't.
I'm holding tight to the idea that the majority of the world is, but has no education in how to get that done.
Oh, that's the truth. We don't learn relationship skills in school. Well, if we do, we learn them incorrectly from peers that are oftentimes less evolved than we are. And
or adults.
And we're at their mercy.
Right. A lot of the garbage treatment that I have endured in my life has come from adults, from my tiniest years onward. Yeah, kids are crappy, but kids are repeating what they see. That's the job of the child mind. Repeat what you see.
Yeah, they're doing the best they can.
Right.
Now, I'm going to self-advocate because I've been working a long day and I'm starting to hit my threshold.
Right. Yes. I've been watching the time. We are a little bit over the hour. So let's wrap it up. Brian, thank you so much. This has been really interesting, and I appreciate how willing you have been to share your journey and your story with whomever will listen, because like you said, we need to be talking.
And I mean, it's win-win. It helps me feel less isolated in my experience, and it helps the others with it to feel seen.
Absolutely. Well, we will talk again soon.